Over time, a dental filling may wear, crack, or become damaged, depending on individual conditions. A dental professional evaluates the existing filling and surrounding tooth before recommending treatment. The condition of the filling and the remaining tooth structure helps determine the most appropriate treatment. If replacement is appropriate, the damaged restoration is carefully removed while preserving healthy tooth structure. The prepared tooth is cleaned before placement of the new restoration. A new tooth-colored filling may then be placed to restore the prepared portion of the tooth. The restoration is carefully shaped and professionally set to recreate the tooth's natural form. The completed restoration is polished and carefully checked for fit, appearance, and function. Professional replacement may restore suitable damaged fillings while helping preserve the remaining tooth structure. This video is for general jari only. If you have a damaged or worn dental filling, consult a qualified dental professional for evaluation and appropriate treatment.